said, a cardiac arrest is when your heart stops. If you're having a heart attack, your heart is still beating. What I like to say is that if you're having a heart attack, you're able to complain about some of the symptoms that we talked about. If you're having a cardiac arrest, you are not able to complain because you're out. Okay? Your heart is doing maybe something electrically, it's beating irregularly, or it's stopped. But you're not breathing, and your heart is not beating, and that is when we do CPR. We don't do CPR on someone that's having a heart attack. We do other interventions. We want to get to you right away and treat you. And as the doctor said, our number one goal really is prevention. We love teaching people about what you can do so that you don't wind up having to have all kinds of medications and all kinds of treatments. The old verbiage about an ounce of prevention is worth a pound, right? My grandmother used to say that, and she was right. Okay. I guess I'm going to just close here and want to invite you to come to our Smart Heart Day. You do have the brochures. And then if you're interested in any CPR classes, you can either talk with me afterwards or pick up one of our brochures at the table. And I want to thank you so much for coming out. It's so important to learn about your health. Okay.
The question is there any danger in the long-term use of statins? And the answer is we don't think so at this point. Of course, as you alluded to, they've only been out for maybe 15 or very commonplace 10 or 15 years probably. And we don't know of any long-term additive or cumulative side effects. Now, when we place anyone on one of these statins or cholesterol medicines, we typically monitor liver tests because they can have adverse liver reactions, and muscle enzymes because they can cause muscle breakdown in a rare situation. And 1 in 4 or 1 in 5 people might complain of a little bit of fatigue or muscle aches, which are usually a nuisance, but not a major threat. It's very rare that we actually have a severe, irreversible problem from these medicines. And in fact, when you look at the statistics, the number of people who are placed on these medicines that survive over 5, 6, 10 years is much better with them than without them if you're at a high risk of having heart disease, or if you actually do have heart disease. So the answer is, we don't know what 20 or 30 years holds, but in the 10-year period, we know you're better off with them than without them in certain situations.
Now, I have a question. Playing a sport and somebody appears to have a heart attack, besides calling 911, should we do anything? Give them an aspirin or? Well,
that's actually where it might be good to attend that Boca Raton Community Hospital outreach program, where they're working on teaching CPR and basic